and welcome to another episode of Undoctored with the Week. Our expert today is Dr. Sandeep Kapoor, an orthopedic surgeon who specializes in replacement and trauma surgery. Welcome so much to the Week, Dr. Kapoor.
Thank you, Pooja. It's been nice to be with you earlier as well.
Thank you so much. So when we talk of bone health, exactly what are we talking about?
So if we talk about bone health, it depends upon the age of the person. So right from childhood up to the growth, predominantly it's basically the calcium and vitamin D involvement and the texture of the bones. That is, it may be strong in childhood and it gets brittle as you grow.
Right. So usually we think it's only when we are aging and our bones start to creak that we have some problem. But as you said, it's multifactorial. So it must be building up since the day that we are born. So as babies, for instance, what does bone health mean and how can it be enhanced?
So as a baby, the child is getting mother's milk, and that's a complete diet. And today, we recommend mother's milk to be taken for almost 1 to 2 years.
Right.
That's the reason you don't, if the child is breastfed nicely, you do not tend to get deficiencies. So as the child grows from infancy to the age of a toddler and the child starts walking, it's the calcium deficiency which comes in because of the nutrition, lack of milk, external milk. Once the child is off mother's milk, there are a good number of children who are not taking milk from outside. And that basically leads to calcium deficiency, ultimately leading to rickets, a very common problem in children. A good number of pediatricians, they see it. And these children, they come with deformities, they come with bumps on the head. There is a deformity on the chest, which is called a pigeon chest. So that's rachitic rosary, that is because of rickets. So as a child, this problem starts because of the calcium deficiency.
Right. And as a child grows into adolescent, teenage?
So in adolescent, teenage, the same problem that rickets, it gets converted into osteomalacia. So a childhood deficiency is rickets, say up to the age of 10, 12, 13 years. But after that age, once the child reaches adolescence, it is osteomalacia. So same problem in the childhood is called osteomalacia in adults, and we get it quite commonly in females. They come with bone pains, and you find that they are walking in a very different fashion, that they waddle. So a young patient coming up with a waddling gait, say a patient in around 20, and the patient is waddling, we tend to see that it is quite a possibility that the patient might be suffering from osteomalacia. And nutritional osteomalacia is quite common in India, and we get to see even today good number of patients, even in affluent families where the children, they are not taking milk and the adolescents, they are not on adequate diet.
Right. And as one grows into adulthood, do these problems change, and also specifically between men and women?
So in men, I would say if the habits are fine, the problems are not too much. But in females, there are certain hormonal changes. There is menopause. So the menopause is because of the hormonal changes. And that is the time when the calcium deposition in the bones declines because the estrogen level falls. That is the female hormone. Once the female hormone falls, the bone is less deposited, the calcium is less deposited in the bones, and that leads to a porous bone, that is osteoporosis. So post-menopausal osteoporosis is common in females, and that's very common.
And then does there come a stage where the problems between men and women become completely similar?
So I would say that after the age of, say, in late 70s, females, they tend to, they get these problems earlier in life. It's not exactly after menopause in 50s, but then yes, 60s is the time when the females, they tend to get more of problems. But for males, it goes in 70s. We tend to get less. But if the patient, I should be, if the person is consuming alcohol and there is a habit in smoking, all that definitely tends to lead to this osteoporosis in males.
Right, right. Now, what is the role of exercise in maintaining bone health? And specifically because many of us exercise out of our own whims and what we get from YouTube. But what would be the correct way to exercise so that our bones remain healthy?
So the best way, see, I told you earlier that as you tend to age, there is a difference in metabolism of calcium. So there
Right,
is an equilibrium till the adult stage, the amount of calcium deposited in bones and the amount which is depleted. There is a positive balance in terms of deposition. It goes up to the age of 40.
right,
After 40, there is almost an equal this thing. The amount which is deposited, the similar amount is depleted. But as you reach 70s, the depletion is more and the deposition is less. So there is a negative balance after 50s. So a simple walk in the sunlight, a regular walk of say 2 to 3 kilometers, 4 kilometers, maybe 30 minutes walk is good for keeping the bones healthy because your muscles, they tend to act while you are walking, and the bones, they tend to get supplements from the muscles itself. It's more of the muscle activity which gives nutrition to the bones. So simple exercises, mobilizing your joints. It could be the upper limb, the lower limb, predominantly the lower limbs because they have weight-bearing areas, the hip and the knees. And it's not a very rigorous aerobics. Simple joint mobilizing exercises and walk, I would say, is sufficient to keep the bones healthy. Sedentary lifestyle definitely creates disuse, gives osteoporosis. So keep the body into use.
right. And you did say that post-menopausal, these problems tend to become, I mean, there is little gender differential after that. So the men who come to you for surgery, as compared to the women, would they be one, other numbers of men more? Two, who would be coming at an advanced age to you for surgery?
So we get more of females because of the post-menopausal osteoporosis is quite rampant, and we get good number of females coming in for fractures, and that is fractures around the hip, the
Right,
shoulder, and the wrist. So the number of females is far more than males.
right,
And males, it is an elderly population, say going up to 70s and 80s. Yes, it's not that males do not come to us, it is there, but the number of females, they are more. And we find while operating, the bone strength is slightly better in males as compared to the females.
right, right. And this has to do with diet plus natural hormonal progression in males and females.
Yeah, hormonal, that progression, that definitely plays a significant role because we find postmenopausal osteoporosis is the key problem in females. And lack of activity. Now, see, the presently in the millennials, we find that there is a good amount of awareness. They are exercising and they are keeping their bones healthy. The ladies are working more. They are conscious, going out, exercising. I mean, but previously it was not there. So that generation which we get right now, the elderly,
Right.
that generation is an older generation. So those people were not exercising. So that's the reason we get these type of, I mean, future, we expect the females to get a lesser amount of osteoporosis. Besides, I mean, on because of this, like muscle inactivity or lack of awareness, I can say. Now the people are tending to get more aware. The ladies are aware. They're taking care of the women health in
Right.
terms of hormones and the rest of the stuff, and as well as in terms of going out and exercising. They are more conscious.
Would it be correct to assume that all of us at some point in our life, despite our best precautions, will get some problems with our bones?
Definitely. That is, it's not that it is a genetic predisposition. It's with the present lifestyle, it's very difficult to cope up. So it's very important that you give some time for yourself and that keep you healthy. And if you are just, I mean, even a few months to weeks, that tends to deplete calcium from the bones after a certain amount of age. So I would say that even taking full care, you can still get these type of problems. But yes, if you're working on it, the chances are less.
Okay, so after taking full care and not having any symptoms as such, when does a person need to be scared enough that, okay, now I need to see a specialist? Now I can't just go to my general physician or get pain medication and it'll be okay.
So after say 60 or 65, it's advisable to go for master health checkups. In those master health checkups, you may tend to get your bone density done, vitamin D3 levels done. So that is the age is the criteria if you should get regular screenings. But if you're not getting done anything, so definitely at the in 70s for males, And in females, mid 50s and 60s, you should be cautious and you should be getting regular checkups done to find your levels of vitamin D fine and your bone density okay.
Right. So you mentioned fracture. Of course, that if I have a fracture, I know I have a fracture. But as for the other thing, which I can't see with my eyes or which I can't feel immediately, what are the indicators that I should be careful about?
So for a young person, like we discussed during childhood, that is if the child is getting deformities, you find that there are bow legs, there are knock knees, there is a deformity in the chest, there is a bump on the head. That child is having some problem with calcium absorption, that or nutrition. So the child should be made to see a pediatrician or a orthopedic surgeon. As you grow, I would say that osteoporosis itself is a silent problem. Osteomalacia, like I said, rickets in child, osteomalacia definitely give bone pains. But osteoporosis is a silent problem. You have to be cautious. And especially in elderly, we find ladies walking with a hump at the back and the height is tending to decrease.
Right.
You feel fatigued. There is listlessness. There is a sort of a mental fatigue as well. So these are very vague and very mild symptoms which might suggest that you should get to see a specialist. Otherwise, osteoporosis per se, it's a silent disease just like diabetes. So you have to keep in check with few test investigations after a certain age. That would be mid 50s or late 60s.
Right. So when surgery becomes inevitable, one, what are the reasons for which I'm going in for surgery? And two, what precautions should I take before going in for surgery?
So, as I told that osteoporosis is a silent disease, the presentation is usually a fracture. And now, a simplest fracture would be a lady, this is because I say there's a gender bias, a lady traveling in a bus and she says that she got a, a pain at the back while sitting while with a jerk on the
Right.
bus itself on a
Right.
highway. And she comes with a backache and we get the x-ray done and we find that the height of a particular vertebra, that is a segment of bone, it
Right.
decreases. We call it a compression fracture.
Right.
So could be as simple as that. But otherwise, usually with a simple fall, like a fall on ground, young person will not get a fracture, but and a person with osteoporosis with a fall with on an outstretched hand will get a wrist fracture. They may get a fracture in the hip or they may get a fracture in the shoulder. So this is the commonest presentation for an osteoporosis, which otherwise is a silent disease. But to the extent, at times we say that hip fractures is a very big economic burden and a social problem to all the families worldwide because the population of elderly is increasing, life expectancy increasing, but the bones are tending to get brittle. So
Right.
even without a fall, they get a fracture. So it's an unsolved problem. The hip fractures, few people say that the fracture produces the fall. At times we feel that it is the fall which produces a fracture. So you can understand the magnitude of the problem that without a fall, the patient is falling because of a fracture. A normal person, say in the age of 80 or 90, there is no fall. And then that person, he just stumbles down and you find on an x-ray that there is a hip fracture. So usual presentation is a fracture for osteoporosis.
One common question which we have in everyday life is, does the kind of footwear we wear impact the health, especially of our knees? So could you please shed some light on that?
So I would say that footwear, definitely a person who is walking sufficiently, there should be a perfect footwear. It should be a good padded sole because
Right.
the biggest problem which we get good number of patients and we call it plantar fasciitis. It's not the knee predominantly which the patients come with. It is basically the problems in the sole. They say their soles, they ache and it's very difficult for them to put their foot on the ground. And this is because of a faulty footwear. And often we advise some modifications in footwear, like a very soft footwear, or even putting in these inserts, those silicone inserts inside the padding of the shoes. But yes, if there is problem in the soles and the footwear is not adequate, even the knees, the back might hurt. So you have to be cautious with your footwear. Not exactly a very good, it's not that the orthopedic surgeons, they recommend a footwear, that you go in for takes Skechers or something like that, but a padded footwear. And at times, there are few companies which are offering, they are making you walk, they are taking impressions of the foot, and
Right.
then they are manufacturing the shoe tailor-made. So this science is coming up. Footwear is definitely very much important, predominantly for the feet, then for the knees and the hip and the spine as well.
Right. So my second last question to you is, with COVID, we see that there is long-term COVID and a lot of health problems now are attributed to the after effects of COVID. Does bone health have anything to do with COVID?
So it's a very nice question, I should say, because we get to see a good number of patients now, not exactly because of COVID, but because of the treatment for COVID. That is, they were put on steroids,
Right.
heavy dose of steroids. Now, heavy dose of steroids, they lead to osteoporosis. That is one of the reasons for osteoporosis. A steroid intake is the reason for osteoporosis.
Right.
And the second thing is it's a common cause for avascular necrosis of the hips. That is the hip joint, the ball. It's a ball and socket joint.
Right.
The ball tends to run out of vascularity. And then once it runs out, we call it avascular. Vascular is blood.
Right.
Avascular means no blood flow in the head. It eventually leads to arthritis, and these patients tend to land up with surgeries, often up to hip replacement surgeries. So steroid patients who have had significant steroid intake during COVID, heavy dose of steroids they were given to patients to fight for the COVID reaction and the reaction against COVID. And steroids, they tend to create problems. It's not COVID per se.
Right, right. So finally, in this very brief overview which we have done, should we have asked you a very important question which we have not? And of course, the rest our readers can read in the column. But for now.
So I would suggest, if we are talking about bone health, we should talk about the person. One should be aware about calcium intake, that is one. Vitamin D3, that is two. Nutrition. Nutrition, the diet. Nutrition is basically the nutrients which you are taking. That includes the calcium, vitamin D, magnesium, phosphorus, those elements needed for bone health. And diet is the specific food which you are taking. So you have to have those type of food, that type of diet, which is basically helping you for the nutrition to the bones. It could be green leafy vegetables, add milk, yogurt to your diet, avoid smoking and alcohol, good amount of exercises, walking, keep your weight under control. And then you have to be cautious that as you tend to age, you have to prevent fall. Because as I told in one line, osteoporosis, like diabetes, is a silent disease, very common in elderly, and these people, they tend to present with fractures. So fracture is the first symptom. Like you asked, what should a person do? So only preventive measures by regular checkups can prevent it. Otherwise, these patients, they come with fractures.
Right, right. Thank you so much for your time, Dr. Kapoor, and we hope to have you at the week again and again. Thank you.
Thank you. Thank you, Pooja.